Today, I am busting the myths about the lies you have been told about childbirth. Let's get to the truth. Welcome back, everyone. Dr. Jen Lincoln here, board-certified OBGYN, and today I am getting to the bottom of those things that you've been told about childbirth and postpartum that are actually complete lies. So let's talk about it. Before I get started, if you haven't subscribed to my channel, if you like us, go ahead and subscribe and turn on the bell so you never miss a new video. Okay, you might be surprised to hear this, but not everything you hear about having a baby is true. I know, you're shocked. But I want to get to some of these lies that I think can be really harmful because it sets you up for false expectations, feeling disappointed, and thinking something is wrong with you. The first lie, and I'm just going to say it, is that epidurals take all your pain away. So that's a lie. Epidurals are awesome, and we are not about to get into a conversation about if epidurals are good or bad or whatever. I'm just here to tell you that if you don't like to feel unmedicated, rip-roaring labor, then an epidural is a great way to go. But it's not going to take away all the pain. Now, for some people, it does, and yay for them. But that's not always the case. So the goal with an epidural is to feel comfortable with still having the awareness that you're having some contractions, because that can be really helpful when it's time to push and have your baby. So while an epidural often takes away a lot of the pain and makes labor totally awesome, it might not get rid of everything, especially at the end when your baby's crowning, because those nerves down there don't get as well protected as the nerves that are higher up that are responsible for your uterine contractions. So as long as you know this and you don't start to freak out when you feel something and think that something's wrong or get really scared because nobody told you this, then you can better mentally prepare. Okay, the second lie about childbirth is that once the baby's head is out, like, you're good to go and that's it. False. So when your baby is crowning and that baby's head is delivered, you are so close to being done, and like the finish line is there. Here's the thing though, your baby has shoulders, and a lot of times it's getting the shoulders out that require a little more pushing and finesse than getting that head out. So it's really important to listen to your doctor or midwife when they're coaching you in pushing, and you might be really tempted when you hear, oh, the baby's head is out, to just fall back and yay and everything's awesome, but you gotta keep going till we get that whole baby delivered and get that baby into your arms. Okay, the third lie. Well, once the baby's out, then you're done, right? Like, you can just snuggle and you're good. Okay, kind of a lie here because the placenta needs to come out afterwards. The good news, you don't really have to do a whole lot. Your provider can help guide the placenta out. We may ask you to push 1 or 2 times to kind of help with that final delivery, but it's not like a baby. Doesn't have a head and shoulders, so it's really nice. But the thing is that especially if you've had an unmedicated birth, it can still be a bit uncomfortable and crampy. So I just want you to know that it's normal. And once that placenta is out, it feels really good. The fourth lie, well, once the placenta is out, now you're done. I know, are you getting mad at me? I'm just trying to be real here. So yay, the placenta's out. It's true that you don't have to push anything else out, but you're not quite done yet. You may need stitches after delivery. In fact, most people do, and it's totally normal and it's nothing to be concerned about. And there are different types of tears when somebody gives birth, from very superficial to deeper. And depending on what you've got, your provider will need to either give you numbing medicine, do a quick repair right there. Sometimes things are a little more intense and we need to go to the operating room to repair them. But thankfully, that's not what we usually need to do. But we do need you to know that we do need to do an exam to look down there, see if you need any stitches, and then of course, stitch you up if that's the case. So the good news with an epidural is that a lot of times you don't feel anything, and even if you do, we can inject a little numbing medicine. Kind of the downside of having an unmedicated birth is that you're gonna feel that. But we can still inject some numbing medication so that it's not painful. But it can be normal to feel the sensation of tugging or pulling. While we are doing all this, you are more than welcome to have that baby right there, skin to skin, and it's what I call baby anesthesia, because when you are looking at that adorable baby, you tend to be a little less aware of what's happening down there. But if at any point in time something's painful, speak up, let us know, and we can help. Lie number 5, breastfeeding is natural, and it will come to you and your baby just beautifully. That is such a lie. And as an IBCLC myself, which stands for International Board Certified Lactation Consultant, I'm an OBGYN with additional training in this area, and I love breastfeeding, and I think it's awesome. And I also need you to know that lots of things that are quote unquote natural doesn't mean that it's easy, right? Think when you were a baby, well, you can't because you were a baby, but when a baby is learning to walk for the first time, I mean, walking's natural, but it doesn't mean that they can run a marathon. So it's kind of the same thing with breastfeeding. It's like riding a bike. You need to practice, and both you and your baby need to practice because it's like the first time that the both of you are doing it together. So I don't want to set you up and make you think that breastfeeding is very difficult and horrible. It can be a beautiful thing, but it is absolutely okay if you feel like there's bumps in the roads and you need help. And and we are there for that, and you can feel free to ask us for assistance. Please don't get down on yourself if the first time or the first day or the first 2 days you feel like you're struggling, your baby's having latch issues. We can help you, and I want you to know there are plenty of people who've started out that way who've gone on to have great breastfeeding journeys. Lie number 6. Well, of course you'll leave the hospital in the clothes that you wore before you gave birth. I mean, look at Kate Middleton, right? This is the biggest lie. And I hate the lie of bouncing back and the idea that we're supposed to bounce back after pregnancy. You spent 40 weeks, give or take, growing your baby. You are not going to go back to what you were in a matter of days or weeks or months or maybe not ever. And that's okay. So do keep that in mind when you are planning with what to wear when you go home. And you may be really surprised to see on postpartum day 1 or 2 that you still look pregnant. And that's okay. Your uterus is slowly getting back down to size, and she worked really hard. It takes a while to do that. So don't feel bad about that. And bring clothes that are stretchy or loose or that you have a little bit given the size, because that's okay. And it's beautiful what you just did. So recognize that and honor your body. Okay, the final lie about childbirth and postpartum is that once you see your baby, you are just gonna fall in love with him, and like that bond, it's there, it's automatic, and oh my goodness, this love, you've never experienced it before. So that does happen for some people, but not for everybody. And that is okay. And that does not mean that you are a bad parent or that you are broken or something is wrong with you. It's intense. It is really intense. Laboring, birthing, especially if things might not have gone exactly how you had hoped, or if there's any medical complications or any issues, it can be really stressful. And that can really get in the way of these amazing feelings and bonding. I want you to know that if you leave the hospital not feeling like how you saw in the books and all of your friends, that's okay. But I do want you to keep an eye on that, because that is something that we, as your OBGYN, your obstetric provider, your midwife, we want to know about if you feel like you're struggling. This could potentially be a sign that down the road, postpartum depression or anxiety might be an issue, and it might not be, but we just want to know about that. And if you feel like you're struggling, that you feel numb, or that you're having any issues whatsoever, let us know. I don't care if it's 3 o'clock in the afternoon or 3 o'clock in the morning. We need to know so we can help you best. But please do not go hard on yourself, and give yourself the space to understand that it's okay if you didn't feel the fireworks right away, and it doesn't mean that it won't happen at some point. Okay, that's all my lies that I wanted to clear up, and the goal is not to scare anybody about childbirth, but to prepare you, because when you're educated, you're empowered. If you have any other lies that you feel that you were told and you want me to discuss them, drop them in the comments. I've got references and resources in the show notes as always. And if you or somebody you know is struggling with any postpartum depression or anxiety, please reach out for help, either for them or for yourself. And if you feel like you're about to harm yourself, your baby, or someone else, please call 911, because that's an emergency and we want to help. All right, everybody, stay safe, and until next time, bye-bye.